name is Adrian Mulig. I'm going to be your student nurse today from 7 a.m. to 3 p.m. Can I please get your name and date of birth?
Shika Naran, 10/21/85.
And do you have any allergies?
No.
Okay, well today I'm going to be completing a head-to-toe assessment. I'm asking you a lot of questions if that's okay.
Sure.
And it shouldn't take more than 20 minutes.
Okay.
So let's go ahead and get started.
Okay.
Do you know where you are?
Yes. I'm at the Tech General.
Tech General Hospital, and do you know what day it is?
Yes, it is Wednesday.
Okay.
October 9th, 10th.
Okay, and you seem to be blinking simultaneously and responding to all of my questions, so that's good. Your facial expression seems normal, and you look like you take care of yourself, you look groomed, and your posture is upright. Okay, now I'm just going to assess your skin. Have you noticed any changes?
No.
Do you have any moles that have changed size, or?
No, I have moles, but no just change of size or anything like that.
Okay, be sure to let us know if that does happen. Your color seems normal. And you're dry and warm. Okay, now I'm just checking to see if you're well hydrated. Have you been drinking a lot of fluids lately?
Yes.
Okay. Now I'm just going to, for edema on your lower extremities, I'm just seeing if you have any fluid accumulation, okay?
Okay.
You don't seem to have any. While I'm down here, I'm going to go ahead and check your capillary refill on your extremities. It's just letting me know how well circulation is getting to your feet.
Thank you.
Looks good. Have you noticed any bruising or lesions lately on your skin?
No.
No? Okay. And now I'm just going to check your capillary refill on your fingers. Okay, that looks good as well. And your nails are pink. All right, looks good. Assess your head. So I'm going to first look at your skull and kind of feel around. Is that okay? Let me know if anything hurts.
It actually feels good.
Feels good. Okay, now I'm just looking to see if you have any dryness. Oh, okay, you look good. Now I'm just going to take a look at your face, okay? Okay, everything looks normal. Now I'm going to take a closer look at your hair. I'm going to look at the color, texture, and distribution. Have you noticed any thinning lately or any balding?
No.
Okay, good.
Thank God.
Alright, your hair feels soft. Okay, now I'm going to assess your cranial nerve 5. So what I'm going to do is I'm going to have you clench your teeth while I feel on your muscles right here, okay? So I'm just looking to see if you have equal strength. Okay, that feels good. Now I'm going to use a cotton wisp. And what I'm going to do is I'm going to put it on different parts of your face with your eyes closed, and then just say now whenever you feel. Can you close your eyes for me?
No. 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 No.
Now I'm going to assess your cranial nerve 7. So what I'm going to have you do is I'm just going to look at your facial symmetry, and I'm just going to ask you to do some different things for me. So can you smile? Frown? Can you puff your cheeks? Can you raise your eyebrows? And show your teeth. Okay, now I'm going to assess your eyes. Have you noticed any change in your eyes recently? Any redness, itching?
No.
Do you wear contacts?
Yes.
You do? Okay. When did you start wearing contacts?
It's been about 10 years.
First, I'm going to assess your pupil size. So if you could just look at me. Now I'm going to just look at your eyebrows. Can you raise your eyebrows? I'm just making sure that they're symmetrical. Now I'm just going to take a look at your eyes themselves. So if you don't mind, I'm going to get kind of close to you. Now I'm going to perform a few tests on you, so I'm just going to ask you to do a few things. Can you cover this eye for me? And I'm going to bring my finger around, and whenever you can see my finger, say now, okay?
Yeah. Yeah. Yeah.
Okay, now can you switch to the other eye? Okay, now I'm going to come to this side. Can you just say now again if you look straight forward for me? So I was just checking your peripheral vision. So now what I want you to do is I want you to follow with just your eyes, don't move your head, my finger, okay? I'm going to use my pen light, and I'm going to have you look at the far wall and then look at the pen light. I'm going to put it right here, okay? So if you could just look to the wall and then to the pen light. Okay, now I'm going to bring the light to either of your eyes, and I'm just checking to see that your pupil constricts. Tell me if it bothers you. Now I'm going to hold the light in front of you for just a second, and I'm just looking for the reflection in your eyes, okay? Do you have astigmatism?
No.
Okay, now I'm going to examine your ears. So have you noticed any changes in your ears recently? Any discharge? Did you have ear infections as a child?
No.
No? I'm going to inspect and palpate your ear. Please let me know if it hurts. Do you feel any pain?
No. No pain here either.
Okay. Now I'm just going to take a look inside your ear using the otoscope. Please let me know if it causes any discomfort for you. All right, I'm just going to pull your ear up and back. Okay. Does that hurt?
No, it just feels weird.
Okay, it looks normal. If you could just turn this way for me so I don't have to move this around. Alright, so I'm going to pull your ear up and back again. Ticklish?
Yeah.
Okay, that looks normal as well. I'm going to whisper a few letters behind you if you could just let me know what those are, okay? I'm going to do it from both sides. Okay,
1, 2, 3.
okay, now I'm going to come to the other side.
ABC.
Alright. Okay, now if you could just stand up for me. If you could stand right here, we're going to perform the romper to see your balance, okay? If you could just stand right here. And I'm going to put my arms out in front of you like this. If you could just close your eyes, I'm just going to see how well you maintain your balance, okay? Okay, thank you very much. You can sit back down. Okay, now I'm going to assess your nose. So have you noticed any changes in your nose? Have you had a runny nose recently? Any kind of cold?
No.
Okay, first I'm just going to feel around on your nose and feel your sinuses. If you could just let me know if anything hurts or is uncomfortable at all. Does anything hurt?
No.
Now what I'm going to do is I'm going to have you tell me what this smell is. So if you could just close your eyes and we'll do both nostrils, okay?
No, wait, cinnamon.
Yes, no, the other one. Now if you could just hold one side of your nose and blow out for me. And on the other side. Okay, I'm just making sure that you aren't clogged up. So if you could just let me know if it hurts at all, okay? Okay, now I'm going to examine the inside of your nose. Okay, now the other side. Okay. Okay, now I'm just going to take a look inside of your mouth. Have you had braces before? No? Okay. I'm just going to take a look at your lips, teeth, gums, and tongue. So if I could just get my tongue blade real quick. I'm going to put this on your tongue. I'm not going to go very far back. If you could just say, ah, and I'll take a look around, okay?
Okay. Ah.
Okay, I'm just going to take a look on the sides. Now this side. Okay, now if you could just say light, tight, dynamite for me.
Light, tight, dynamite.
Now I'm going to assess your neck. So can you please turn this way for me and that way? And can you look up and down? Do you have any pain while doing that?
No.
Okay, I'm just going to feel your lymph nodes. Is that okay?
Okay.
All right. Let me know if you have any discomfort, okay? Do you feel any pain?
No.
Okay. Okay, now I'm just going to ask you to swallow for me. Okay. Now if you could turn your head against my force this way. Okay. And the other way. And now I'm going to ask you to, against my resistance, shrug your shoulders. Now I'm going to just feel for your carotid pulse. other side. Okay, now I'm going to assess your respiratory system. Have you been having any trouble breathing lately or anything?
No.
Okay, do you have asthma?
No.
Okay, I'm going to just feel for your spine real quick, making sure that it's in line. I'm going to feel your scapulas. Okay, now what I'm going to do is I'm going to press against your back. If you could just say the words 99 for me.
99, 99, 99, 99, 99, 99.
Okay, and now can you, I'm just going to have you take some deep breaths in through your nose and out through your mouth every time that I